Yes, it's real. Let's talk about how acoustic sound waves applied to the side of the penis can get you better erections. Let's talk about whether you're a candidate for it. Listen up, guys. Hey guys, Dr. Segel here. So the question is, I read about a treatment where they apply shock waves to the side of the penis to get guys better erections. Is this for real? Short answer, yes, it's for real. But let's talk about all the details of it. Let's talk about why it works, how it works, if you're a candidate for it. At the end, I'm going to give you my pearl of wisdom that hopefully gives you some insight as to whether you should sign up for it or not. So stay tuned for that for sure. So we use Gaines wave therapy in our office. Apply sound waves to the side of the penis and help guys get better erections. Let's talk about the logistics of it. Now, this is for guys with problems generating erections, erectile dysfunction, or sometimes curvature of the penis, or both, called Peyronie's disease. Okay, the way it works is that we apply a probe to the side of the penis. It can break up plaques in blood vessels within the penis, and it can induce inflammation in the penis, stimulate new blood vessel growth because of that inflammation that's induced. In addition, over time, they postulate that it can improve nerve regeneration in the penis. Now, in general, nerve regeneration anywhere in the body takes the longest, so that's not one of the typical short-term improvements that you'll see. But they also say that it can improve the sensitivity of the penis as well. This is called low intensity shockwave treatment. Okay, it's not really strong shockwaves to the side of the penis because that will be problematic for a variety of reasons. The logistics of it, usually 6 to 12 sessions, 15 to 20 minutes each session. So remember, erectile dysfunction tends to be a flow problem. Blood's not getting readily into the penis, and guys get less strong erections because of it. So the idea behind Gaines wave is that if we can apply shock waves to the side of the penis and inflammation gets induced, growth factors result in the penis, stimulate blood vessel formation, improve blood flow to the penis, and guys get better erections. People want to know what the session is like. In general, in our office, guys get there a little bit early because the shock wave to the side of the penis is pretty darn well tolerated, but we still want to give them some numbing cream so it's even better tolerated. So they'll have the numbing cream applied. We'll wait 20-30 minutes, and then we'll do the treatment. The treatment itself takes 20 or 30 minutes. Some guys are, quote, pros at it, and they want to make it a really quick office visit. And so some of these guys will apply the numbing cream at home and then come to the office so they can just be in and out, and that's perfectly fine. One of the questions that guys want to know when we're going through all the treatments for erectile dysfunction is, are they a candidate for it? I think one of the most important things is that you have to have some erectile function, okay, with or without medications. If you do, then we can consider doing Gaines wave therapy. If you don't, we should think about something different to treat you for your erectile dysfunction. There's also this idea of killing two birds with one stone with this therapy, meaning that guys with Peyronie's disease, which is curvature of the penis, and erectile dysfunction can benefit from Gaines wave because it treats both of those simultaneously. There's few treatments that really do this. Some medications do, penile prosthesis does, but this is one of them. So I think it's neat for guys with both of those problems to treat them in one fell swoop. We'll say, well, I have a lot of medical problems. Is there any reason why I can't get this done? At least on the Gaines wave website, they really say that there's no what we call contraindications or medical reasons why you can't get this done, which is nice. Obviously, for many of the other therapies, erectile dysfunction, medications, surgery, etc., there are reasons why you can't get those done if you have other medical problems. But this, they at least say, there is no contraindication or reason why you can't get it done. People want to know the cost. So on their website, they say about $500 a treatment, and that seems like about right in our experience. 6 to 12 treatments initially. The frequency with which these treatments are done is very customizable. Oftentimes in our office, we'll do a treatment every few days for the first 6 treatments, and guys want to know whether they're getting any kind of benefit from it. And then if it works out for them, and some guys will start to see effects within 4 to 6 weeks, a lot of guys will, frankly, and they want to proceed with additional treatments, then they'll get maintenance treatments every couple months for the remainder of the year, and that kind of takes them to the 1-year mark. They say that erections can be stronger for 3 years after treatment. In reality, a lot of our guys that are getting some effect will get this maintenance therapy, so I don't know whether they're getting erections for 3 years because of the initial treatment that they got or because they're getting the maintenance therapy, but at least the GamesWave website says this. I think it's a very highly variable thing. And this brings me kind of my pearl of wisdom, the way that I want you guys to think about whether you should do this or not. There are 2 things that you have to consider. Number 1, damage to your wallet, right? So $500 a treatment is nothing to sneeze at. It is a big chunk of change. So if you're willing to risk that kind of damage to your wallet, then I think it's certainly worth considering. And also, do you get some erectile function? Do you get erections with or without medications? Okay. There are some guys that say, Doc, medications don't work at all. And then I tell those guys, don't waste your money on this GamesWave because you're just, flushing your money down the toilet. But if you get some effect with erections and you're looking to get erections harder, stronger, longer, then I think that it's a good therapy to consider. It's very difficult to say a percentage of guys that get a benefit, but I would say in our experience, the majority of guys that get GamesWave therapy that get some effect with medications notice some improvement in the quality of their erection. In fact, one kind of group of individuals that it's really worked well for us with are younger guys that say, they just want to kind of get a little firmer, a little stronger, a little bit longer erections. It can work really well for them. So that's a group of individuals that oftentimes will do GamesWave therapy. Anyway, I hope that gives you a framework on how to think about this therapy, whether you would want to spend the money on it. Thank you so much for listening. Please subscribe to our channel. We certainly appreciate it. I hope you guys have a great day. Remember, we release at least 2 videos a week. Thanks.